All right, welcome everybody to this episode of Transplant Talks. I'm Rachel Davis, living liver donor, psychiatrist, and mentor for the American Transplant Foundation, and I'm with my co-host Anastasia Henry, who's executive director of the American Transplant Foundation. And today we are talking with Dr. James Burton. He is a professor of medicine at the University of Colorado Anschutz, the section head of hepatology, or he's a liver doctor, and he's the medical director of liver transplant. So welcome, Dr. Burton.
Thank you. Nice to be here today.
And I will turn it over to Anastasia to get us started off today.
I've been waiting for this day and for this episode for a long time. My cousin, who was my best childhood friend, he died from liver failure before he turned 35. So this is extremely personal. This is extremely challenging subject. And also something that I'm so passionate about, because liver is the only organ in our body that can regenerate. We have an epidemic of liver disease. We'll talk about it. And we are so excited that we were able to get Dr. Burton. He's one of the leading hepatologists. He's amazing. He's passionate about liver health. So let's jump in. Thank you so much, Dr. Burton, for being here.
My pleasure. Great time. This is a great topic and one that I think it benefits many people and something I enjoy talking about.
Yes, and for all our listeners and for all our YouTube viewers, so listen up, because you're going to learn some incredible information that potentially can change your life and the health of your liver. Let's start with the notion of liver epidemic. The first time I heard about liver epidemic, specifically in the state of Colorado, was earlier this year. Can you explain what it means, liver epidemic, liver disease epidemic? Is it local to specific states, or is it a nationwide issue?
Well, I think this, when you refer to like an epidemic of liver health, I mean, there's multiple things that refers to. I think the one thing that stands out for us in our liver center is the very widespread and increasing use of alcohol in America. This was something that was going up before the pandemic. I think the pandemic lit it on fire. I think we were fortunate enough to start developing some processes and evaluation of people with severe alcohol-associated liver disease. But those rates were increasing before the pandemic. And then, as we all sat around in our pajamas, doing Zoom calls for the first time and having happy hour at 2:00 in the afternoon, I think this is when things really started going up. But, alcohol is not the only problem in America right now. And there's other problems associated with a term called metabolic dysfunction associated steatotic liver disease. That's a fancy way of saying fat inflammation in your liver related to metabolic derangements like obesity and diabetes. This too is a problem in America, and it's something that's been going up. You're seeing this in younger and younger people. And the consequences of this is all these conditions can lead to cirrhosis and require transplant.
If you think about your patients 10 years ago, what was the average age when people actually had a liver failure versus now?
Yeah, that's a good question. Actually, I used to see older people coming to me. When I say old, I'm talking about my own age, in their 50s, who were diagnosed with cirrhosis. A lot of these problems had not really been developed. Might be people who had longstanding diabetes, obesity, never told they had any problems with their liver until they decompensated with complications of jaundice or ascites, fluid in the abdomen. Or it might have been, older men who were longstanding drinkers of alcohol, who came in with their wives and said they'd been drinking alcohol for all their lives and had developed cirrhosis. I think in the last 10 years, we've started seeing younger and younger people with these problems, particularly with alcohol. I mean, I am today seeing patients who are in their early 20s who need liver transplants and finding out that they've been drinking alcohol since, they were 13 or 12 years old. That is a big change. And I think the other change I'm seeing is younger and younger people who have abnormal liver tests, who have diabetes and obesity at an earlier age. And I'm looking at these people now in their 30s and I'm saying, hey, I used to see you in your 50s, but now we're seeing them earlier. We now have some things we can address some of these problems with. But certainly the age has shifted to younger people. And for alcohol, a big shift has been women. I'm seeing more and more women who are developing alcohol-associated liver disease than I had 10 years ago. So it's both a change in younger people and more females.
So how much alcohol is too much?
Well, it's a good question. I think whenever I see a patient and I'm talking about alcohol, you just can't ask how many drinks do you have. You have to quantify what a drink is. And I remember seeing this woman in the hospital once, and it was this big mystery of what her liver disease was. Though if you looked at her labs, it was like classic for alcohol-associated liver disease. And everyone kept asking her, what do you drink? She goes, I drink 1 glass of wine. And she was from Burma, and there was a language barrier and everything. And I went in to see her because no one could figure it out. And I asked her, I said, well, how big is your glass? And she picked up a glass like this big, and it held an entire bottle of wine. And she was drinking that every day. No one ever asked her, how much wine are you drinking? It was just saying 1 glass. So, I mean, I have patients who have glasses that will fit an entire bottle in it. So you need to ask what you're drinking. When you say, I always go through finding out, how do you buy your alcohol? Do you buy it with a handle? Do you buy it in pints? Do you buy it in 6-packs? Quantify what they're drinking. And then I ask, if you drink beer, do you drink craft beer? Do you drink, Bud Lights? I mean, those are very different amounts of alcohol. People, if you're drinking bottles of wine, do you drink a whole bottle yourself? You split it with your spouse? I mean, this gets you an idea of how much you drink. If you're pouring mixed drinks, are you just kind of good like this, or are you actually measuring shots? So once you can identify perhaps how much people are drinking, then I start saying to men and women, 1 drink is moderate drinking for a woman. 2 drinks would be moderate drinking for a man. I often find that people underestimate how much they're drinking, and most of the time I can actually double it. So I think once I identify how much alcohol people are drinking, then you can start to engage the patient into, well, that's actually quite a bit, especially for a small woman. One thing that's not been known over years is bypass surgery for obesity can put you more at risk for having alcohol-associated liver disease.
Wow.
With the same amount of alcohol. So these people might not necessarily have an alcohol use disorder, but they're doing the same things they were doing all before, but they're not realizing that the impact of that alcohol can have on them.
So many takeaways just from this one answer. So first of all, it's probably, if you have any concerns about your alcohol usage, it's a good idea to get a simple app and just track your numbers, right? Track your, what are you drinking? How much, right? And then when you are talking to your doctor, they've heard it all. You've heard it all, right? If you say, I drink a bottle of wine, and you think you're like the only person, yeah, right. Like I've heard it all, right? When nobody's going to surprise you. So just being honest. So you're not going into circles, right? Just being honest and saying, this is where I am right now. I would like to do better, but this is what's happening. I think that's number 1. And then number 2, so there was a very specific example of a woman who was drinking a bottle of wine a day, a night, and she did develop liver failure. So as I was preparing for this episode, a very good friend of mine told me that her primary care practitioner, they told her and her husband that if they drink 2 glasses of wine per night, every day of the week, perfectly fine.
Well, I would say for a woman, that would be moderate to severe drinking. For the man, it would be moderate drinking. It might be okay. I think as we've learned about alcohol, this whole thing about the French paradox and there must be benefits of drinking red wine. Actually, I think there's really no data that drinking alcohol at all has any benefit at all. I mean, not only does it have complications with liver disease, it has complications of cancer. It has complications of raising your blood pressure, extra calories, obesity. I mean, I wish I could tell you that drinking alcohol is going to save all your problems, but there's really no benefit of alcohol, in my opinion. Now, that doesn't mean one should live a life of sobriety if you don't want to. I mean, I enjoy having craft beers and a nice glass of whiskey from time to time. But I mean, I don't think that it's about how you utilize it in your life, and how does it impact your life, not only from your health standpoint, but how does it affect your relationships with other people, and your work, and those kind of things as well. So it's not like alcohol is just a health benefit. It can have all kinds of ranges of problems.
And we can't forget the psychiatric problems, of course.
Absolutely. Absolutely. And a lot of times I see people who start drinking alcohol, when I kind of go back and go, when did this happen? They say, well, it used to help me sleep at night, and yeah, it will help you sleep, but that sleep you're getting is not good sleep. And a lot of times people turn to their depression or their anxiety by drinking alcohol. And, that first drink or two, it probably, it helps kind of relax you and stuff. But then with that third or fourth, you're probably causing more harm. And you know what? There's lots of good treatments for anxiety and depression out there that one shouldn't have to turn to alcohol.
Right. Do we know why some people end up with cirrhosis and others don't? Or is it that everybody who drink a certain amount would end up with cirrhosis?
Well, thank God not everyone who drinks heavily ends up with liver disease, because I would be in a world of hurt. I've seen that about 10% of heavy drinkers will develop liver disease. And there's obviously issues related to genetics. I think there's cofactors with other liver disease. So you may have, this whole term of metabolic dysfunction associated steatohepatitis, or that can be, there's now a term called MET-ALD, so metabolic problems with too much alcohol. I think, there's probably, people always tell me, well, I don't drink hard alcohol. Your liver doesn't care how it looks. It's a 2-carbon chain that gets to your liver. And a lot of the times it's not the alcohol going to the liver and causing damage. A lot of where the injury starts is in the gut, in the intestine. It causes inflammation. And that inflammation, all the blood from your gut goes rushing to your liver. So that inflammation, that cascade of events that leads to fat and dysregulation and metabolism problems in the liver occurs. And that's very unique in each certain individual. And so I don't, most people can, I see people who drink tons, and I'm afraid, sometimes amazed they don't have liver disease. And then I have people come to my clinic and go, well, God, my brother drinks twice as much as me. How come he's not sitting here in front of me? It's very variable. And I don't think you can just measure the amount of alcohol and know that you're going to develop liver disease.
So when we're drinking that one glass of Prosecco, basically what's happening, there's inflammation that is happening as we, having that one drink. So it's,
I mean, when you drink alcohol and you break it down in acetaldehyde, which causes you to have the feeling of being hungover the next morning, that's not necessarily causing the damage. It's the ongoing inflammation at the level of the gut that causes inflammatory cytokines and mediators of inflammation to go to the liver. There's dysregulation of fat. What's very interesting about alcohol-associated liver disease and non-alcohol associated liver disease, underneath a microscope, they look the same. They both have fat in the liver with associated inflammation. And honestly, sometimes I'm shown a biopsy and I can't tell the difference between someone having too many donuts or too many Budweisers. They can look the same. So it's interesting in that the two biggest causes of liver disease in America, alcohol and metabolic associated dysfunction of fatty liver disease, those are the two leading causes in America, and they look the same on imaging. They look the same on a biopsy.
So if listeners are listening to this and maybe getting a little bit worried, what should they do if they're concerned about their drinking?
Well, I see patients sent to me for abnormal liver tests from their primary care doctors oftentimes. And the question isn't, is this alcohol? The question I'm posed is, why are their liver enzymes elevated? And I can tell sometimes walking into the room that it's due to alcohol. There's very characteristic findings about the way the pattern is. There's very characteristic findings on the imaging. You can see other lab testing that can suggest it. So, in terms of, I think just asking people, if you get to me and for me to tell you you're drinking too much, these people have been doing this with their primary care, or maybe they've even thought about it themselves. So again, I don't think it's as much as just to ask people, how much do you drink? I have 3 drinks, check, and move on to the next thing. You should ask, okay, 3 drinks, you're a woman. How are these drinks? And find out that it's 6 drinks. So I think we all probably need to, stop and pause and look at how much we drink. I mean, if you think about it, back in the olden days, you could only drink wine and whiskey, and there were bad beers. And now we live in a, especially in Colorado here, we've got a huge craft beer industry, a huge craft distillery business. They sell seltzers now with alcohol in them that are fortified with vitamins, and we're told that this is somehow healthy for you. So, I mean, the amount of access to alcohol is overwhelming. It's kind of become kind of expected. I mean, it's advertised on TV. You can't go to a sports game without lots of alcohol. So I think it's something, tobacco kind of shifted, and you started putting warning signs on it and saying this is bad, and we outlawed tobacco in restaurants and on airplanes. We don't do that with alcohol. We serve alcohol in airplanes. We serve alcohol at all these events. And so I think that when the baseball started being faster, there was criticism we won't be able to drink as much beer at the baseball game. So I think there is a big problem in America that we drink too much. We have too much access to it. And you guys are at least raising this question for people to start looking at how much they drink.
Yes. And I think, as someone who grew up in Eastern Europe, and definitely alcohol, it was your number one prescription medication, right? Antidepressants, everything. However, there was not a culture, at least back in the days when I lived there was not a culture of this everyday consumption of alcohol. So if there was a big party, everybody would go crazy. But nowadays, with all the wine clubs, it's like, oh, I'll just have 1-2 glasses of wine every single day. Can you talk to us? How can you affect the health of your liver if you simply don't drink every day? Maybe if it's just 1 or 2 glasses, but let's say you only drink 3 days a week. Will you make a difference for your liver?
Well, I can't say that it's going to make you worse. It's got to be helpful. I mean, I guess if you're there's the chronic daily use of alcohol, but also binge drinking is equally as bad. I mean, for a man, that would be 5 drinks, for a woman, 4 drinks. And I mean, even if you binge drink once a week, that probably has the same impact as having moderate drinking on a daily basis. And in terms of defining what an alcohol use disorder is, binge drinking 4 or 5 times a month would be considered abnormal. So, I think drinking less is the benefit. How you go about doing that is going to be good. But I think if you just put all your drinks from the week and put them on the weekend, I'm not sure that's going to necessarily help you.
And my suggestion was, instead of let's say if you have these 2 glasses, 1 glass per day, if you simply keep the same amount, absolutely no binge drinking. But let's say you give your liver a thoughtful rest 3 to 4 days a week.
Yeah. Well, I think there's a lot of things related to alcohol that people don't realize, causes problems, So I see people who are having a hard time losing weight, and yet they're drinking 2 glasses of wine a night. And I'm like, well, gosh, you could cut that out. And you're getting rid of calories. I mean, the improvement not only in blood glucose control, your sleep, high blood pressure. I mean, people start to feel better when they stop drinking. I think that's something you notice even after several weeks. And, we were talking earlier about, the benefit of taking a month off of alcohol. January is coming up. People notoriously want to quit drinking in January. I think a lot of the benefits of stopping alcohol for a month is looking back and seeing how well you feel. And I think a lot of people don't realize the impacts alcohol has on your overall health. And sometimes just taking that that month of dry January to really feel like, oh my God, I feel so much refreshed. I'm saving money. Every aspect of my life. I have more energy. I have more, I can think better.
And we actually, this January, for the first time ever, we will be doing Liver Refresh Challenge. 4 weeks. We're going to start January 10. And I encourage everyone to sign up. It's a free initiative. You will learn so much about your liver health, and we'll try to reset our livers and learn healthy new habits together. So go to AmericanTransplantFoundation.org to sign up. That will be a really fun initiative to do together. Some other questions that I have. So some patients ask, what about liver detoxes? Can we buy something from Amazon that plant-based fix and this and that? Some people do cleanses, right, with machines. What are your thoughts on all of that?
I see people every week who have some liver toxicity or a drug-induced liver injury, which I often contribute to some herbal supplement or some cleanse or something where a patient is taking it because they're under the impression it's going to help them. So a lot of those things are not regulated. Some of them may have what might be considered benign things, but you don't know what else is in there. The liver was designed to do this work it's doing. I mean, you have more liver than you need, first of all, as evidenced by the fact that you can take 60% of it out and give it to someone else or throw it in a bucket if there's a tumor in there. So your liver is very resilient. I think this idea that your liver needs to be detoxified or cleansed is really not based in any fact or reality, and that a lot of the things that you could do to live a healthier life for your liver is to eat better, avoid alcohol, get your blood glucose under control. If you lose weight, the fat's going to go away. I mean, a lot of these things are things that are going to help you more than something you buy on Amazon in a cleanse. I think it's a gimmick, to be honest with you. It's a quick way of thinking I'm doing something. But I think if you really want to have good liver health, you really got to focus on your entire health and your whole body.
Are there any supplements that are particularly harmful or notorious for leading to liver damage?
Well, I mean, there's been toxicity with ashwagandha, which a lot of people swear by, and when you bring it up, they feel like that's no way I can stop doing that. Cumin has big concentrated capsules of that. I've seen patients come in with liver toxicity. I've seen red rice yeast toxicity and people thinking that's going to be good for them. I mean, there's so many things out there that I think are in packages that claim things. And, a lot of times I can look these up on, the NIH has a good website on drug toxicity as well as herbal toxicity. And sometimes you can find the drug that particularly that the person's taking, and sometimes it hasn't been reported. But I mean, whenever I see someone with an unexplained liver injury and I find they're taking supplements, I have to tell the patient, they could be in this basket of pills you're taking here. I have no idea. And I don't even know what's in all these things. Oftentimes, if I can convince the patient to get off everything, their liver tests get better. And then a few months later, I get their labs back and they're back abnormal again, and the patient's gone back to taking them. It really probably requires taking them all off and then going back each one and seeing which one has it. I mean, there's some that, I'm not talking about vitamins here. I'm talking about herbal supplements, things that, you don't know. These things are not regulated by the FDA. What's in them may be true. What's extra in there is probably what the problems are.
Is there such thing as taking too many vitamins?
You can get liver toxicity from taking too much vitamin A. So, I mean, there is well-described toxicity from vitamins. I mean, honestly, I think if someone is taking vitamins, they're probably just having expensive urine, because your body, if it doesn't need it, it's just going to get rid of it. And people who really need vitamins, I think, are people who have chronic gastrointestinal diseases where there may be impairment of the absorption of vitamins. Or you might have I can think of some severe liver diseases where you might have a problem absorbing fat-soluble vitamins. But for healthy people eating a well-balanced diet, I mean, our bread in America is fortified with thiamine and folate and things. I mean, as long as you're eating a well-balanced diet, I don't think most people need vitamins. Now, does taking a multivitamin hurt you? No. Does it hurt your pocketbook? Maybe. That may be up to a person to decide what they want to do, but I don't think most people who are healthy don't need to take vitamin supplementation.
Now, what if someone has had a liver transplant? Are they more at risk for effects from certain vitamins or are more likely to need certain vitamins?
I would say as long as their liver transplant's working well, the goal of a liver transplant is to make you back to normal. And most of my patients who have had liver transplants, I would consider as normal as you and me. And the only difference is they take an immunosuppressant medicine that most patients don't take.
And then there's Tylenol. So what about Tylenol? I think a lot of people don't realize how much Tylenol is too much.
That's a good question. When I see patients in my clinic, most people have severe liver disease. Most patients I am seeing in my clinic have end-stage liver disease and need liver transplant. And they ask me what medicine they can take for pain. And surprisingly, I tell them they should take acetaminophen or Tylenol. Acetaminophen and Tylenol, if taken in doses of 2,000 milligrams a day, even someone who has the worst liver function at the top of the transplant list can tolerate that. What's bad for people with cirrhosis and severe liver disease are taking non-steroidal anti-inflammatories. These can cause ulcers in the stomach.
Mm-hmm.
These people have a lot of congestion of blood around the stomach, so a little bleeding turns into a lot of bleeding. And most importantly, in severe liver disease, those drugs can precipitate kidney failure. So I think it's very well known that people are told, oh, you can't take acetaminophen because you have liver disease. I usually counsel my patients that they can do it because they've often been told they haven't. And if you look on the bottle of acetaminophen, it says, please consult your doctor. I think in America, the one thing that's a problem with acetaminophen and Tylenol is that you can go to Costco and buy 500 tablets in a bottle, though in the United Kingdom, they put it in blister caplets. And they've actually shown a reduction in acute liver failure from acetaminophen. And it's probably because people just get tired of popping the pills when they're having a suicide attempt. But in America, you can go to Costco and easily buy 2 bottles of 500 milligrams and without any ease take it. So I think in America, the problem is one of too much ease. And you got to keep in mind, there's a lot of other medicines with acetaminophen in them, cold medicine. So you need to look on the back of any medicines you're taking to see what's in them. Cold allergy medicines might have acetaminophen in them. And then, the fact that the tablets are not 250 milligrams, but 500. You can get up to 2,000 milligrams pretty quickly.
Well, do we want to talk about living liver donation? Because that is such an exciting and not well-known area. So often I'm talking to someone and they're like, you can donate a part of your liver and you're going to be okay. I was like, yeah, talk to Rachel Davis.
Well, as you mentioned earlier, it's the only organ except for maybe your skin, if you consider that an organ that can regenerate. Yes, it's remarkable that you can take someone's diseased liver out completely and replace it with 50-60% of a normal liver. And within a month, both of the liver in the recipient and in the donor have gone back to their normal volume. One thing about living donor liver transplant, the liver, it doesn't regenerate like a salamander's tail. So if you donate the right lobe, it doesn't just grow back. If the donor's left with the left lobe gets bigger and the recipient receives the right lobe, the recipient's liver will grow back. But yeah, it's something we do here at the University of Colorado. There are a number of places across the country that have the expertise in doing this. I mean, the outcomes with living donation are equivalent to having a cadaveric transplant. I think in my line of work, I see lots of people who are sick and would benefit from a liver transplant, but they're just not sick enough to get high on the transplant list. I tell people when I see anyone who needs a liver transplant who is not so sick that they need a full liver or are already at the top of the transplant list, I do discuss living donor liver transplantation, it's like getting out of line. I mean, if you're on the transplant list, it's like being in a long line, maybe at a barbecue waiting for hamburgers to be thrown on your plate. Living donation is like coming to the barbecue with your own steaks. I mean, you don't have to wait in line. It's a scheduled procedure. I've seen patients who need to improve their nutrition. So we have a goal date of you're going to improve your nutrition to get a transplant on a Tuesday in December type thing. So it takes away a lot of the when will I get transplanted, the unknown. It's an incredible, I mean, I don't want to minimize the risk to a donor. It's a major operation that a donor is going to undergo, especially if it's a right lobe transplant or donation. Though I have seen the benefits of it, and we've all seen the benefits of it. And it's something that, I think if I know a lot of patients have a lot of, I don't want to put my loved ones through that. I sometimes turn it around and say, well, how's your loved one going to feel if you die on the transplant list waiting for that thing? And why get so sick that you're in the hospital or in the ICU on dialysis to get your liver transplant? There's so many times in my career where I've seen a patient who has the very beginning stages of, requiring a transplant, and they're saying, well, I guess I'm going to have to get sicker in order to get better. And I'm like, well, why don't we just do this now? Why don't you take a month off of work? You can have a liver transplant. You're not going to lose out on your health, put yourself at risk. Your recovery is going to be faster. So there's a lot of benefits of this option. Unfortunately, it's not, available for everyone. But it's one of those things. If you don't ask people, no one's going to do it. I had a police officer, and he had a disease of his bile ducts, and he felt like he didn't have anyone to donate him. I said, "You're a police officer. Do your fellow police officers know you need a liver transplant?" He goes, "Well, I don't. I'm a pretty private person and stuff." And I go, "I can understand being private, but I guarantee it. If you go and tell your crew of firefighters or police officers or other former military people that you need a liver transplant," and he did. On the following week, he did, and 4 people wanted to come forward to donate. So you'd be surprised. I always tell people, I have family members who want to be the advocate for the patient, and maybe they aren't candidates to be donor, but they could be a donor champion for that recipient and getting the word out, getting it out on social media, mentioning, my brother, my sister, my aunt, my father needs a liver transplant. Hell, blame it on me. Go back to your community, go to your church and say, Dr. Burton says I need this, if it makes you feel better. But it can make a huge difference in people's lives.
Yeah, and I think what a lot of people don't think about, well, when you're the one who's sick, it's hard to think about it, but a lot of us, in fact, the majority of the population feel better when we do things to help people, right? For those of us who aren't sociopaths. And I will say personally, donating the right lobe of my liver is one of the coolest things I've gotten to do in life. And it was an honor and a privilege. And I was, I'm happy I was and still am healthy enough to do it. And I think speaking with other living donors, people feel the same way. Like, it's a really cool, exciting thing to do, and it's nice to be able to help someone.
Right. I've never met anyone who did it who regretted it.
Right.
Same.
I do have a question that I'm curious about, though. I think for some liver diseases, they're viewed through a lens of judgment, or the idea that someone did this to themselves. So, for example, with alcohol-related liver disease or metabolic liver disease, do you use, let's say, alcohol-related liver disease? Do you use living donors for alcohol-related liver disease? And is there controversy about that? Do people who are non-directed living donors have concern about this? I mean,
well, that's a good question. I mean, when I see a patient who has alcohol-associated liver disease, one could argue metabolic-associated liver disease could, have a role in there. I mean, historically, decades ago, there were people with hepatitis C who got hepatitis C through intravenous drug use. So I mean, as a physician taking care of people with liver disease, my role is to take care of the person's liver disease. And if I think that a living donor would be good for them, that's between me and that recipient. Now, when I see a donor to evaluate a donor, I do ask them, especially if they're coming forward to donate specifically to someone, if they know why they have liver disease. I do like to hear that they know that it's due to alcohol. And I do ask them, how would it impact you if, the recipient went back to drinking? Because, alcohol use disorders are diseases that are characterized by relapse. And, the biggest predictor of long-term sobriety is maybe being sober for 5 years. So I think the fact that someone might have a slip can happen. So when I talk to a donor, I always kind of go through how would that make you feel and everything. And surprisingly, I think the type of people that come forward to be donors are doing it for the right reason. They aren't being judgmental, and they're there to give them a chance at living. Altruistic donors that we have, this is something we've been doing at the University of Colorado more and more since 2016 or 17. If someone comes forward and doesn't know someone and wants to donate, I bring it up and say, well, liver disease from alcohol is a common cause. I mean, is that something you're against? I've never met like an altruistic person who's already half of them have already donated a kidney who says, oh, no, it must not go to a person who drinks alcohol. A lot of times, I can't say that most of the times that is an issue. I mean, obviously, if someone comes forward being altruistic, we do want to make sure that, we're not going to, I guess my point about if we're offering someone a liver transplant from an altruistic living donor, we feel that person is going to do well with that organ. Much like everyone on the transplant list. I mean, we wouldn't put someone on the list if we didn't think they were ready to have a transplant and make good use of that gift. So, but it's a question that comes up, and we often bring it up. The hard thing is if someone says, oh, I was told the recipient has hemochromatosis, and you're like, that's not what they have. That doesn't feel quite right, but that rarely comes up.
So this is one of the very popular questions that we are being asked. So if somebody has a liver failure due to alcoholic abuse, and they feel like they're not worthy, they will never get a transplant from a deceased donor, from a living donor. This is simply not true. And the medical team will work with you, and they will make sure, like if this is a person who says, I've been drinking all my life and I'll continue to drink all my life. Well, that's probably not the best candidate for transplant. Like that's not going to happen. But if the medical team is certain that this person is on the path of sobriety and committed to sobriety, and there are resources that are available, do you provide support for your patients to make sure that they stay sober after the surgery?
Well, I tell people, look, we're not doing a brain transplant. We're doing a liver transplant. And you have an alcohol use disorder, okay? It has caused you to go into liver failure. And if we just fix your liver and don't address the alcohol use disorder, we are ignoring the major component that caused your problem. And a lot of times people, I've only a few times in my career has someone said, I plan to go back to drinking after a liver transplant. Most people say, I'm never drinking again. Well, granted, that's what everyone tells me, but data would show 20 or 30% of people will have a relapse and go back to at least some component of drinking, maybe not harmful drinking. So I always approach it as, look, we need to give you the tools to understand why you drank, to understand, what the circumstances were around why this happened to you. And it's not just me making this decision, it's a multidisciplinary group. We have everyone who has an alcohol use disorder sees a transplant psychologist, they see transplant social work, they see a hepatologist, and we, in most cases, will have the patient engage in alcohol treatment going before a transplant. And it's not like just because someone is 6 months sober and has done the treatment, oh, everything's going to be fine. I mean, there's some people who have done alcohol treatment, are 6 months sober, and I think they're high risk to going back to drinking because they've done it all their life. So I don't know why this would be any different. I think what has changed is that we have now seeing younger and younger people who have had shorter and shorter periods of heavy alcohol use, who are presenting with severe alcohol-associated hepatitis, where they're going to die in the next month or so without a liver transplant, and they don't even have time to engage or approach their disease, much less comprehend every aspect of their disease. So I think that has been a change for our program, and I think a lot of programs in developing what I might call a high-risk pathway or a limited sobriety pathway, where maybe people haven't fully done the work they need to do, but they show good prognostic indicators. They've got social support, they've got insight, they recognize the use of alcohol in them. They don't have comorbid psychiatric diseases, personality disorders. It's not like they failed alcohol treatment several times, including inpatient stays and things like that. So they've got some good favorable factors. And we started a process of evaluating patients like that in 2019. And I'm really glad we developed it, because when the pandemic hit, everything just went nuts, and we were ready for that. And the first 30 patients we put through that pathway, not one of them had a relapse with phosphatidylethanol test, which is a test that can really assess for, probably more, at least moderate alcohol after a year after a transplant. Now, I think when we re-looked at that data, we said, we may have been a little too strict in our criteria, because we probably should have seen some people relapse, and then we kind of maybe expanded a little bit and then saw some relapse. But we've realized that we don't have a 6-month sobriety rule. There's nothing magic about 6 months. I mean, the reason sobriety should be entertained before transplant is, your liver has the ability to regenerate, as we're talking about, and your liver can improve once you stop drinking. I sometimes see people at a month that I think are going to die in the next several months, and I start the process of evaluating transplant, and then they come back in a month and they're dramatically better. And so I think sobriety, the reason one should have sobriety is you might not need a transplant.
Now, if someone gets to the point where it looks like they might need a transplant, say they're sick enough that they would need a transplant, but then they're sober, they're able to get out of the hospital, and they have what we call compensated cirrhosis, or, they're able to function with their liver disease. Are they eventually going to probably need a transplant, or could they possibly live the rest of their life like that?
I have many, many patients who I have taken care of for now coming up on 20 years with alcohol-related cirrhosis, who have well-defined cirrhosis. Their liver works completely fine. The only caveat is that they're at risk for developing liver cancer. So they do need to have at least twice annual imaging of their liver. But having cirrhosis does not mean I'm going to die without a liver transplant. People need liver transplants if they have cirrhosis with complications. And those would be varices, these dilated veins in the esophagus that can bleed, ascites, fluid in the abdomen, hepatic encephalopathy, goofy confusion from not being able to clear toxins, or liver cancer. Those are reasons to have a transplant. There's also, you might be doing totally fine, but there's a scoring system called the MELD score. And if it's, it used to be 15, it's probably down closer to 11, where you will have benefit of having a liver transplant than keeping your current liver. But the type of patient you're talking about that I take care of has a MELD score of 6 or 8. That's my MELD score is 6. So it is not a death sentence. And I wish there were people who, so many times I see people in my clinic who are coming to see me for a consult, and they've spent the last month waiting to see me thinking I'm going to die any minute now. And then I say, well, the good news is you're going to make it, and so just having cirrhosis is not a death sentence. And I have lots of patients with cirrhosis. The management of that is really making sure you get screening for cancer, which in patients with alcohol-associated liver disease, hepatitis C, even if it's been cleared, you're talking about rates of 2 to 4% a year of getting cancer. I've got 100 of those patients being seen in my office every month. I mean, 2 or 4 of them are going to get cancer every month. Now, you can't, with liver cancer, that often requires transplant, because the definitive treatment of liver cancer is surgery. And if you have cirrhosis, you can't often just whack off half your liver to take a tumor out. So it often is an indication for a liver transplant.
I would like to ask you, how can you test your liver health? I just had a conversation with a volunteer 2 days ago. And he said, oh, I go to this acupuncturist and she does something and she tells me the precise health of all my organs. Let's address that. And what can you actually do to find out how healthy is your liver?
Well, that sounds wonderful. I wish I had that test to be able to tell everyone. Well, I mean, I sometimes see people who have had imaging of their liver that shows cirrhosis, and you look at their labs, you look at them, and there's no way to know that they had cirrhosis. I mean, it is true that most people with liver disease have overt evidence of it with abnormal liver tests, but there are with hepatitis C, for example, 10% of people with normal liver tests, people used to think, oh, you don't need any treatment or worry about this, but 10% of people with hepatitis C would develop cirrhosis. There's a percentage of people out there with fatty liver disease, with obesity, diabetes, who probably are developing fibrosis with normal liver tests. So I mean, in terms of, are there true liver function tests? There are a few tests out there that can actually assess, the function of the liver. They're not something you do probably for people who don't have any other suggestion or signs of that. I would have a hard time thinking that you could stick a needle someplace in the body and know everything about it, but I must admit, I don't have that experience or expertise, but I would say just because there's people out there with fat in their liver who have normal liver tests who don't know it, and it gets picked up incidentally. Well, just having simple fat in your liver may not be a problem. However, if you have simple fat in your liver because you drink too much alcohol, that's a potential problem. If you have fat in your liver and you're obese and you have borderline diabetes, that potentially could be a problem in the future. So I think when you find these things, it does lead to, raising your threshold and trying to, modify the risk factors that might put you at risk for developing liver disease in the future.
And that I will say, I do have people come to me and say that they're worried they drink too much. Can I check their liver enzymes? And I often say, sure, yes, we can. And also, your liver enzymes may be just fine, and that doesn't mean you're not drinking too much.
Yeah, absolutely. I mean, I sometimes see people who I see and knowing they have alcohol-associated liver disease, and then they go on a period of sobriety and then they see their liver tests are normal and then they think, oh, I can go back to drinking. So, I mean, I think the difference between an alcohol use disorder and having alcohol-associated liver disease are two different things. There are way more people out there drinking way too much alcohol, putting themselves at risk, climbing ladders, driving intoxicated, falling down the stairs, not to mention, their relationships with other people, their spouses, their family, engage in impacts on their work that have nothing to do with the health of their liver. And as we've said multiple times, there's so many benefits of limiting alcohol, not just for, liver health. And having normal liver enzymes would be suggestive of it's not causing major problems for your liver today, but it doesn't mean go out and drink more or don't address all the problems alcohol may have in your life.
And I think it's important to point out that alcohol use disorder does not discriminate, right? So I treat a lot of very high functioning patients, including physicians and, other professionals who have alcohol use disorder. And it's also not a disorder of fault. It's like you said, you don't do a brain transplant. It is a brain disorder, and it's a brain disorder that we have treatments for. And, I asked earlier, what can people do if they're afraid they might be drinking too much? And one, we'll put some resources in the description of the video here so that you can kind of check things out on your own. And also, I would encourage you to go to your primary care doctor or even your therapist and just broach the topic and say, hey, I'm worried that I might be drinking too much. And most providers will not be judgmental. They'll actually be thrilled that you brought it up and that they're curious and that you're interested in learning more, and we'll be able to support you in that. If you don't feel comfortable going to a healthcare professional, you can just Google alcohol support groups, and you'll find all sorts of groups. There's AA, if you're not a big fan of AA. There's different variations of peer support groups. As Anastasia mentioned, there's apps, so you can just go into your app store and Google alcohol use or stop drinking or, anything like that. You'll find apps that can help you. So, I think we've talked about a lot of things today that might be kind of scary and might make people feel bad, like maybe they're doing something wrong. And I guess what I really want to highlight is it's not wrong. It's just something that can affect your health, and there are things you can do about it. So it's important, I think, to be aware of the impact it can have.
I couldn't agree more. I think one thing I do see is patients who are referred to me, they've got liver disease, and for some reason in their mind, someone with an alcohol use disorder is someone drinking out of a paper bag and, in the alley. I've seen very successful, companies, business company owners, and I've seen mothers taking care of 3 children who do an excellent job of taking care of their kids. The problem is when the kids go to bed, they're turning on Netflix and having 4 gin and tonics, but they get up and do the work the next day. So, I mean, it is not, I think there's a stigma sometimes associated with this that maybe prevents people from getting help. I mean, you can do alcohol treatment completely online these days. And that's very helpful for us living in a rural environment where people can't get to some of these resources. But there's a lot of different options, as you mentioned, I think, for people to get the help they need. And I think the first thing is just maybe doing an inward look and seeing how much you do. There are some calculators online that can questionnaires. I think audit is one where you can fill out 10 questions and it kind of puts you in a category of whether alcohol has it. The CDC has a check your drinking part of their website that asks you questions and then tells you what the chances are you might have a problem with alcohol. And I think those are some things to kind of consider and start with.
And also, if you are drinking heavily, more than several drinks a day, you probably don't want to just stop, because a lot of people will go through alcohol withdrawal. So it's important you reach out for support in cutting back and eventually quitting.
And if you are on the wait list for a liver transplant, or you're interested in learning more about living liver donation, we have an incredible mentorship program at the American Transplant Foundation. So make sure to check it out. And maybe you can even get Rachel as your mentor.
All right. Well, thank you, Dr. Burton and Anastasia. I think this has been a very interesting and useful discussion, and it's been a pleasure talking with you.
It's been my pleasure talking with you as well. Have a great day.
Thank you.